everyone, welcome to case study 11.1, a picky eater. Greg is a 3-year-old boy who is growing at a normal rate, but he has not developed the ability to talk yet. Greg has not yet received a nutritional or medical diagnosis, though he has been seen by his pediatrician for his feeding issues. He prefers to play alone, and he will consume almost exclusively apple juice and very specific starchy foods which are high in carbohydrates. Greg will only eat in front of the television and tantrums when he does not get his way. His lack of speech, social isolation, tantrums, and extreme food pickiness indicates that he likely has autism spectrum disorder and just has not been diagnosed since he is only 3 years old. There are various signs that indicate Greg's feeding problems may be related to his speech. The fact that he tantrums and throws food that he does not like indicates that he is frustrated in his inability to communicate. Greg's feeding problems due to autism spectrum disorder are behavior-based and should be addressed immediately. Generally, a child with ASD creates a self-restricted food selection and often tantrums or refuses to eat at all when given foods that they do not like. Since Greg cannot communicate these frustrations, this can also result in crying and tantrums. Greg's speech therapist should work on feeding with him but does not. So he should also be referred to a nutritionist and a special education program that will focus on the behavioral aspects of his feeding issues. Due to Greg's condition, waiting for him to mature into accepting other foods into his diet will not be successful. In autism spectrum disorder, early intervention is critical, especially with feeding issues. Children with ASD should be offered a new food many times, sometimes 15 to 20 times over 1 or 2 months depending on the success rate. Nutrition interventions as well as behavioral interventions should take place immediately. Waiting will make changing these eating patterns even more difficult, as the rigidity of ASD and the behavioral component that goes along with it only gets more difficult to manage with time. Greg may be meeting his caloric and protein needs, but he is only meeting these intakes from apple juice and starches, which are high in sugar. He does not eat any fruits or vegetables, and the excess of white starchy carbohydrates will eventually lead to obesity and risk of chronic disease. Greg should be placed in a special education program where he will be given special attention for his feeding problems. In this type of program, he should be given positive reinforcement for trying new foods, which would typically include giving him a small amount of his preferred food for trying a piece of one of the new foods being introduced. Greg's pediatrician told his mother and grandmother that Greg will eat when he is hungry. However, that is often not the case with children with ASD. Due to sensory issues, children with ASD often do not respond to hunger cues the same way that typical children would. The behavioral aspect also plays a role, since Greg throws a tantrum and refuses to eat when he is given foods that he does not like, which is common in children with ASD. Because of this, the pediatrician is wrong in saying that Greg will eat when he's hungry. Nutrition and behavior interventions should be provided immediately.